National Medical Stores was established as a statutory corporation in 1993 by an Act of Parliament under the Chapter 207 of the Laws of Uganda. NMS's mandate is to procure, warehouse and distribute essential medicine and medical supplies primarily for and to the government health facilities. This mandate sits in the middle of the supply chain.
The supply chain is the whole end-to-end, starting with the health facilities identifying their needs, which is called selection, to the point where they quantify their needs, meaning how much of each of those items do they need. And then we link up, the supply chain goes to the financing. Where is the money to buy what has been quantified? Where is it coming from? And from there, once we know what health facilities need, we have the resources, then we will start our mandate of procurement.
And as a government entity, we are bound by the regulations of procurement, and that is the Public Procurement and Disposal of Assets Authority guidelines. We acquire the required medicines and medical facilities for use by public health facilities.
We warehouse them in our premises here, and we wait for the orders, because now the orders is the responsibility of the health facilities. They order, and then we deal with the last part of our mandate as NMS of distribution.
NMS has faced many challenges, learned from them and evolved into a globally recognized high-performing operation. And the main drive of this has been a tireless quest to optimize efficiency. Previously, money for procuring medical supplies in government facilities was given directly to individual health facilities, who would in turn buy from NMS. This posed a great challenge to the corporation.
National medical stores would go out to borrow money from the banks and then procure these medicines and wait for the health facilities to come and buy, as it were, and pay for them. This long cycle was creating inefficiencies, and the first inefficiency they were creating is that the people of Uganda will have already provided the money, but instead of giving the money to the entity with the mandate, you are giving it to the customer. So we were able to go to government as a value proposition. We said, if you give us the money directly, the first thing that we'll have to knock off would be the interest that we are paying to the banks on this borrowed money. And that money will not be lost. It will be converted into medicines.
NMS lobbied for the recentralization of funding for the essential medicines and supplies.
Following the decentralization of funds for the procurement of medicines and medical supplies to national medical stores, we've made great strides in ensuring the availability of the required medicines and medical supplies. NMS contracts both local suppliers as well as international suppliers. We ensure that we have framework contracts for all the items that we have, and this has shortened the procurement lead times.
Today, NMS procures and handles stock that is anticipated to top over R1 trillion per annum. It involves thousands of types of medicines and equipment for over 3,000 government health facilities across the country.
Out of every 100 shillings that we get from government, 92 shillings is medicines. It's only 8 shillings that go into the operations. So even without increasing the budget, government was able to get 25% more medicines than they used to get through the inefficient system.
The fact that at any given time, NMS has over 300 billion shillings worth of stock in its warehouse makes it unsurprising that the stores and operations department is the largest.
We have an annual throughput of about 800 billion throughout the year. And we have about 12,900 pallet locations here in Entebbe. We also have 811 cubic meters of cold storage space.
NMS developed and adopted suitable warehouse software that improved efficiency of its operations.
One of the most important bits of software is CMT. This tool is very, very instrumental when it comes to making stock available. It is a tool we use to manage the over 400 contracts we have for essential medicines here. So this tool gives us the ability to monitor the orders we have placed for them, and it's given visibility to all stakeholders within the corporation, that ability to actually look into the system and know exactly when we can be expecting stock from our suppliers. We have a system that we call MAX, and this is paired with another system that is called SAGE, and the two work in tandem basically to make sure that they can give us the inventory management that we require up until 99.9%. That is our inventory accuracy.
For many years, theft of government medicines remained a concern to all stakeholders. Stealing was aided by the fact that medicines in both private and government facilities looked the same. NMS drastically reduced this pilferage by starting to emboss product. Government medicine and equipment is clearly marked Government of Uganda, not for sale.
With the embossment that we are putting on these medicines, it's very easy. One, anybody who finds this medicine in the private sector, one will ask them not to pay for it because probably it's in the wrong place, but it is your medicine. Just speak it and go. But two, inform the nearest law enforcement officer, nearest police station, the nearest security officer, so that these people can go and arrest these people and bring them to court. And for all the people that have been brought to court and found with the medicines, anyways, there is now 100% conviction because of the easier way of identifying this. They would tell us that the conviction rate before the embossment was less than 5%. In 2010 financial year, the availability of medicines in government health facilities was at 21% of these essential medicines. Now, Ministry of Health and Partners have been going out there, and the availability has been put at 85%.
Embossment is done on both the primary and secondary packaging, and it forms part of the stringent process of quality assurance NMS has put in place to ensure that all medicines pass the tests of quality, safety, and efficacy.
There are two packages here. This one is what we call a primary pack. The primary pack is actually the packaging which immediately houses the product, and this one is a secondary pack. As part of quality assurance, there are certain parameters or specifications, international specifications, which a product must meet. So we check for the name of the product on the label, the batch number, the manufacturing and expiry dates, the strength of this product, like in this case, this is cotrimazole cream 1%, then the name and address of the manufacturer, the conditions for storage, and if this product doesn't meet like these international labeling requirements, that alone will make us reject that product or the consignment outright.
NMS also strictly ensures that it only receives drugs that still have 75% of their shelf life.
A product has got a manufacturing date and expiry date. So the interval between the manufacturing date and the expiry date is what we call the shelf life. So if a product has got 4 years shelf life, NMS will demand that by the time it is entered into the warehouse at NMS, it must be remaining with 3 years.
This, however, has not stopped the corporation from being accused of destroying and even distributing expired drugs.
The focus internationally, all over the world, is on the extent of expiry, how much has expired.
We're also able to minimize wastage from any kind, and this may be damages or expiry to less than 0.5%, which is well below the industry standard of 5%.
Our board of national medical stores said 5% of 1 trillion is too much. Those are too many billions. So they gave management a standard of 2%. Over the past 5 years, we have posted less than 0.2%. And internationally now, we are known to be the warehouse that has the lowest expiry.
The efforts of NMS are recognition of the fact that stakeholders in the health sector are interlinked and need to be engaged.
The responsibility of health facilities is divided between the Ministry of Health and the Ministry of Local Government. And actually, majority of the health facilities have their mandate lying on the side of the Ministry of Local Government. Ministry of Health only starts from the referral hospitals. We also have, of course, many other important stakeholders in the work that we do. We have the principal stakeholders who are the government, the members of parliament that we share information with. We have the political leadership in the Ministry of Health, the Ministry of Finance and Economic Planning. So we have systems here for quality, but the main responsibility for quality of the products for medicines and medical supplies lies with the National Drug Authority.
There has always been a blame game among line institutions of who was responsible for late delivery of drugs or outright stock outs. NMS's assurance of delivery is backed by the delivery schedule, the document commonly referred to as their manifesto. It is pinned on the notice boards of all the health facilities NMS serves.
The delivery schedule is a document that forms the contract between ourselves as national medical stores and all the facilities, the more than 3,000 facilities that we serve in the country. What that document spells out is that it clearly gives you the specific dates, telling you if you belong to this district, you are expected to give NMS your order of what you want within your budget by this time. The date is spelled out. And we say that if you have given us your order by that date, NMS must have delivered medicines to you by a specific date, which is also mentioned. It has helped with transparency. It has enabled everybody to now know the standard that they should hold us responsible for.
Vaccine integration was another NMS innovation, and it has vastly improved all-around service delivery in Uganda's health sector. Vaccines are unique in nature, their storage demands extra care, and their administration can be irregular. No wonder that around the world they are normally delivered in schedules different from those of the ordinary medicines. However, NMS challenged this norm, and they have successfully integrated vaccine delivery into their regular supply chain.
We are being invited to talk to the world in Copenhagen at the center of UNICEF, to talk to the world how this could ever happen. Who could ever have dreamt that that could happen? And now it is an example that we are selling to the rest of the world. To integrate vaccines, because once you integrate, the costs of distribution come low. So the savings that you made, you procure more vaccines for the children.
By 2014, Uganda's immunization rates had risen from a paltry 52% to almost 100% due to this integration. NMS has benchmarked these innovations on technology by deploying an array of ICT tools to back them up. The tools have upped both efficiency and transparency.
Another very key tool that was developed recently, again in-house by our IT team, is what we call the DMT. This is our delivery monitoring tool. This tool gives us real-time visibility of the downstream operations of NMS. Basically what happens here is that before a truck driver leaves our premises here, he must key in that he's actually leaving. He must log in where he's taking the supplies. And by logging into this system, we have it set up in such a way that an SMS will be sent to all stakeholders within that particular health facility that is going to receive the commodities or that particular district.
Our trucks have left NMS coming to you in Arua, coming to you in Kabale, coming to you in Hoima, coming to you wherever.
Now, this can be received by SMS, this can be received by email, or if somebody has access to the web, they can actually log in and they can actually see deliveries that are bound to be delivered at a particular facility.
When we actually deliver these medicines, again, another message goes saying the medicines that you sent have been received. It gives the name of the person who has received it, the telephone number of that person who has received, and we copy that message to each and every responsible person in the Ministry of Health. We copy it to each and every member of parliament in Uganda now. If you go to the Speaker of Parliament now, she knows which medicines, when we deliver the medicines to Kamuli district.
If they know communities have been delivered to the districts or to the individual health facilities, they can then follow-up complaints of stockouts, because this has been one of our challenges, because we make deliveries to health facilities, and for one reason or another, patients who go to these facilities are told that the commodities are not available, which sometimes and quite often is not the case.
Currently, NMS serves 3,065 health centers throughout the country. Following up and satisfying such a big clientele is not an easy task. The creation of regional customer care officers has enabled NMS liaise better with them.
They have the people who help the facilities under them, in each set of the districts under them, as a liaison between them and NMS. Remind you when you are supposed to place your order, advise you on the medicines that are available at NMS when you are making orders, ensure that your order gets to NMS in time, and when it gets to NMS in time and we have delivered, making sure that they come back to you and ask you if you have any issues with the deliveries that we have made. It gives us an opportunity to have first-hand information on what is happening.
The lower health centers 1 and 2 constitute 70% of the facilities NMS serves. It was, however, noted that officers in these facilities would delay placing their orders. In order to improve on this situation, NMS innovated the basic kit model.
What we did was to help them, sit with them once in a year and make an order, a standing order for them for the entire year, so that in case they do not want anything out of that order that they would have given us at the beginning of the year, they just write to us just to stop the item that they don't want and replace it with the item that we want.
NMS also knows it needs to engage those tasked with informing and educating the public.
One of the most important stakeholder we identified was the media. We meet them now once every quarter and share with them on the updates. This is what we promised to do. This is what we have achieved. Have you identified any gaps? Can you bring them to attention? Can we explain them to you? Can you in turn go and explain them to the people of this country?
NMS also registered a major milestone in 2012 when they introduced the last mile delivery system. Before, NMS would deliver to the district health officers, who were then tasked with deliveries to the various facilities in their districts. Such a system was vulnerable to all manner of inefficiencies.
Either the supplies would disappear from the district stores, or they would not reach in time. They would have challenges, transport, they don't have allowances, they don't have drivers, their vehicles are broken down. We said, let's help you out at no additional cost. We will take these medicines, yes, offload them at the DHO's office, but you don't touch them. We will send our own people at our own cost to pick these medicines from the district headquarters and deliver them to each and every individual health facility. That's what we have done. And now, it is a model that is being copied all around the world.
NMS has been given a clean bill of health by various auditors and financial authorities. This has improved confidence in the institution, with a number of development partners and agencies now engaging NMS as their distributor of choice.
We are a preferred warehousing facility and distribution for the US government. 2 months ago, we are signing another implementation letter where they'll bring about $90 million worth of products into NMS. Global Fund used to have a grant and has a grant for ARVs, for HIV, for malaria, and for tuberculosis. But with the confidence they've had in national medical stores over the few years, now that grant is 95% commodities. We are doing the same for UNICEF. We are doing the same for UNFPA. We've done it for UNHCR for some of the products that are going to the refugees. So DFID has brought commodities here. Clinton Health Access Initiative, CHAI, has brought commodities here.
It's no wonder the volume of business here has grown tremendously. Over the past decade, stock handled has risen from 50 billion per annum to almost $1 trillion today. This, however, created a challenge of space. Proactively, NMS has undertaken the construction of one of the biggest facilities of its kind in Kajansi on Entebbe Road.
The warehouse we are going getting into, which is under construction, that we hope will be handed over to us by latest April next year, is on 10 acres of land, and is going to be having a holding capacity of 32,000 pallet positions.
We shall be able to store a lot more commodities in terms of range and volume, and this should mean that facilities should not have any problems getting commodities as and when they need them from us.
Even if the population of Uganda expanded another tenfold, that warehouse should be able to serve the entire population adequately. This is going to be the biggest warehouse in the whole of Africa for medicines and health supplies. And if we talk about government-owned warehouses, it's going to be the biggest in the world.